I went back and I learned about lifestyle medicine because when I did my patientworld.net platform, one of the doctors I hired to do a course on the platform, she's a lifestyle medicine doctor. The American Medical Association put out a resolution in 2017 saying physicians need to learn and apply lifestyle medicine. I mean, we now know how to put type 2 diabetes into remission in a lot of people, decrease the risk of cancer, live longer with cancer, and everything in between. I give them the tools so when they sit down in the doctor's office, the doctor walks in, within a minute or at most two, they can go through and hit the bullet points that the doctor is going to want to know to expedite that diagnosis. Hospital every other month because all the way up to retirement, you did not make the wisest choices. What good is $10 million in the bank going to do you when you can't enjoy it? So I like ewg.org. That is one of the more reputable sites that you can go to and you can learn, okay, I'm reading the label on this cleanser I use on my table. Because if the patient is informed, the patient can tell you 90% of the time, within reasonable doubt, what your diagnosis is. But we have not trained people how to do that. You need an advocate because, to be quite honest, if you're in the ER and they just gave you a shot of pain medicine and the doctor's coming in and asking you questions like, I don't know.
Welcome back to Dad Puzzles today. We have a special guest, Coach Dr. Hester. Thank you so much for being with us today.
Thank you for having me.
Awesome. Yes.
So, my name is Ann Hester, aka Coach Dr. Ann. I am a double board certified physician. I practiced internal medicine for almost 30 years. Then I decided to pivot. Now I do more administrative things, but I'm launching a coaching business as well, and I've always been very passionate about empowering people. Even when I was my third year in medical school, I started writing my first book, and I just wrote my third book just 2 or 3 years ago, and it's all about empowering people. And so, again, lifestyle medicine. Internal medicine was what I was initially trained in, but then I did a pivot. I went back and I learned about lifestyle medicine because when I did my patientworld.net platform, one of the doctors I hired to do a course on the platform, she's a lifestyle medicine doctor. I went back. I've been a doctor for all this time, and I had no idea about all the research and the science out there that teaches people how to prevent, treat, and reverse disease. I mean, we were taught that this is the disease, these are the pills, this is the surgery. Lifestyle medicine is an emerging field around the world. The American Medical Association put out a resolution in 2017 saying physicians need to learn and apply lifestyle medicine. The data is that strong. I mean, we now know how to put type 2 diabetes into remission in a lot of people, decrease the risk of cancer, live longer with cancer, and everything in between. So my baby now, my passion now is to help people prevent, treat, and reverse diseases through the pillars of lifestyle medicine.
This is amazing. How can we go ahead and teach people to really have the reasoning and close that gap between doctors and patients?
Well, I'm glad you asked that. My most recent book is called Patient Empowerment 101, More Than a Book is an Adventure. And that's based on decades of watching doctors and patients just not seeing eye to eye at all. I worked in a hospital for much of my medical career. And you don't have to go to medical school to understand these concepts. Early on, I did a lunch and learn for a landscaping company. And so the people were basically high school educated. They may not even have their high school diploma, but after an hour, we did mock doctor-patient interviews, and they hit the nail on the head over and over. You just have to be taught these things. We have not done a good job at teaching people how to be good patients. We go to medical school. Nurses go to nursing school. There's no patient school. And so this book, Patient Empowerment 101, More Than a Book, It's an Adventure, gives you a deep dive, and it's a fun read, humorous and so forth. It's not on the medical level. It's like on the 8th, 9th, 10th grade level. So anybody can understand it. But it teaches you everything from what your insurance could mean to the ABCs of communicating with your doctor. I once interviewed a lady. I asked her a yes or no question, and I knew she was going to take a long time. So I just sat there. It was a yes, no question. It took her 10 minutes to answer because she had no idea. She had to think through it. Well, then I did this. And she had to think through it like that. So what I go through in the book is I explain to them before you go to the doctor's office, think through your symptoms with these specific steps. So when you sit and you're at the doctor's office on the examining room table, you have maybe 5 minutes face to face. You're angry because he or she is an hour behind again. You're cold, sitting on that cold table, and you're in pain. That's not the time to try to pull all this together. It's not. Because essentially what frequently happens is the doctor's going to run out of time. Okay, well, let me order this test, this test, this test. Let's try this medicine. Come back and see me in a couple of weeks when I have an appointment. So you've lost time away from work. You've prolonged your suffering. You may end up with a lot of tests that you didn't need to have that are going to cost you a lot of money, and medications that can have side effects that aren't going to work. So I teach people how to see eye to eye with physicians. So when they sit down, just like you've heard of the business elevator speech with 2 minutes, I give them the tools so when they sit down in the doctor's office, the doctor walks in within a minute or at most 2, they can go through and hit the bullet points that the doctor is going to want to know to expedite that diagnosis. I shared this information with somebody a few months ago, and she ended up in the ER a few weeks later. And she pulled out her notes on the phone. And so she went through all of these things. The doctor came in, diagnosed her quickly, treated her in her home, and at the end of the conversation, he asked, "Are you in the medical field? I've never had anybody speak to me that way." That's the point. You don't have to go to medical school. You just need the proper tools.
Amazing. Thank you. I think this is very powerful, and we really all need it, even for people that, let's say, they can be in the medical field sometimes, but you cannot be that organized because you assume that people understand you. So I think it's a good book to read to everybody in all different backgrounds, correct?
It is. It is. And actually some of the ratings, some of the people who read the book were physicians. But most of the people, it's on Amazon, but most of the ratings are from people who are not doctors. And they just talk about, it's a very easy read, it's a fun read. But when you finish it, your level of power will have gone from here all the way up here.
Amazing. Thank you so much. Thank you. So teach us a little bit, let's say we're at the family table and we have the food situation, with the shared meals. How can we transform our health, because sometimes, this is a big deal now, like our stores, they don't have the right stuff that we need, or sometimes it's there, but we just don't know how to make them because of our cultures,
Well, first let's go back to the shared meal concept. I told you that I'm board certified in lifestyle medicine. Connectedness is one of the 6 pillars of lifestyle medicine proven to help prevent, treat, and reverse certain diseases because of all of the chemical interactions, the hormonal fluxes and so forth, and the positivity of being connected. And so that is therapeutic in and of itself. So family meals are very important. Another thing, getting back to the meals themselves, it's really important for parents to teach their children at a young age. You don't need everything that you see advertised.
Right.
There are chemicals. I tell my kids, you're going to glow in the dark if you eat that. My kids, they're teenagers, so we go shopping, they pick something and go, it has chemicals, and they put it down. So they're learning at a young age, all this trash they put in our food, if it's made in a laboratory, your body was not meant to handle it. And there may be inflammation or other things associated with eating certain foods. For instance, high fructose corn syrup. There's a strong association with liver disease. When I was in medical school, if you had cirrhosis, advanced liver disease, that means you drank a lot of alcohol or you had some form of hepatitis, viral hepatitis. And then I started seeing a lot of people with advanced liver disease who didn't do anything, and they weren't, they had fatty liver, but they weren't overweight. But now we know the high fructose corn syrup can cause liver disease. And liver disease can lead to cirrhosis, and cirrhosis can lead to cancer of the liver. I mean, something that's simple. Read the labels. Get in the habit of reading labels when you shop. Be careful how you cook. Fried foods, they taste good. But we now know that frying causes these chemical processes to occur. And chemicals are created that can be hazardous to your health, aside from the impact on your arteries from the fat. But you can create aldehydes, what we call AGEs. So the way that you cook can actually promote cancer-causing, diabetes-causing chemicals, even though you start with healthy food, so to speak. By the time it gets to the plate, it can be hazardous to your health. And so just, first of all, the parents need to understand. The parents need to get the information. And then once they apply the information, the kids will just naturally take up. My husband taught my little girl at a young age, broccoli means ice cream. So if she ate a broccoli, she got ice cream. So she's 16. She loves broccoli. She doesn't have to have broccoli and cheese or anything on it. May have some more broccoli. So the parents, they play a pivotal role in priming the kids for now and for their future health.
You know how it is in the grocery store. The vegetable area is not that big of a. I used to not eat most of it, but my wife, she's their culture, they're big into vegetables and stuff like that. So that helps me a lot. So my kids now, they don't have any problem with it. So I'm very lucky about that, because most of the kids, they do not like vegetables. I grew up myself not liking spinach. Whenever that is being cooked, that was my miserable day, So I understand most of the people, they're not having a good background with vegetables and the greens and the different colors, of course, the carrots and stuff like that.
Eat the rainbow.
Yes, exactly. I love it. I should start sharing those, because people do not know these different colors have different beautiful ingredients in there. I took a course from lifestyle medicine, just knowing how 6 pillars and what it constitutes. A lot of people are missing out. It's a lot, but it's something that we need to know.
It's vital. We spend all this money, all this time working hard, putting money into retirement. So if you think about how many years of retirement you could lose from dying early or being sick,
right?
It's just not balancing out. So we need to regroup. We need to realize, okay, I'm working hard. I want a nice retirement, maybe retire early. I want to travel. I want all these things.
Right.
But if you're in the hospital every other month because all the way up to retirement you did not make the wisest choices, what good is $10 million in the bank going to do you when you can't enjoy it? And so we need to go back to the basics, learn what we can do naturally. It's not going to cost us anything extra other than, if you like organic, which I prefer over other vegetables. That's about it. I mean, you can walk around your neighborhood for free. You can put these 6 pillars into play without spending another penny, and they can potentially decrease your risk of dying early. Tremendously decrease your risk of dying early.
Amazing. So for parents, dads, and like mostly with this lifestyle thing, what changes can we apply in today, like sleep hacks or any of those things to make us better?
First of all, a whole food plant-based diet is huge. You don't have to be a vegetarian. I'm a vegetarian, but if you eat meat, make that like the side and not the main plate. So focus on fresh foods, vegetables, grains, legumes, nuts, seeds, and so forth. And different colors, as you mentioned. Because once you do that, you're giving your body all of these different nutrients. Different foods have different nutrients. And a lot of people don't realize all food has protein in it. People think I need to eat red meat. No, you don't.
Right.
All food has a certain amount of protein. If you have a whole food plant-based diet, and if every now and then you want some salmon or something, certainly that's okay.
Right.
That is key. Exercise. Keep it moving. We now know that sitting too long is like the new smoking. Even if you are very physically active and you jog several days a week, if you spend a lot of time seated on movie binges or so forth, that still decreases your life expectancy. So every 30, 60 minutes or so, get up and do something. If you're watching TV, just get up and walk in place, go to the bathroom, get some water, do something. Social connectedness, that's very important. Making connections, that does something to the hormones that make us feel good and relax and so forth. So that's huge. avoid substances. And I don't just mean alcohol and tobacco. You want to avoid the toxic substances like in your toothpaste, in your deodorants, in everything. I like ewg.org. That is one of the more reputable sites that you can go to and you can learn, okay, I'm reading the label on this cleanser I use on my table. Oh my gosh, this can cause cancer. This is an endocrine disruptor. They give you other chemicals. And so people really need to understand what it is that they're inhaling when they walk in the kitchen and they just put all these chemicals all over the place, or when they're slathering on lotion full of chemicals. So that's important. Sleeping is huge. If you're not getting enough sleep, all those hormones get disrupted, and we now know there are studies that have shown an association between night shift work, and breast cancer and other diseases. I mean, you need restful sleep. And stress, mitigating stress, that is also huge. There's one thing, if you slam the brakes because the semi is up front, you're going to be stressed for that moment, maybe for a couple of hours. Chronic stress can kill you. Chronic stress is associated with multiple diseases, and the life expectancy goes down. So if we look back, if you have a whole food plant-based diet, your gut microbiome is going to be happy, going to be spitting out the positive things that make you feel good. Exercise, spitting out the positive things that make you feel good, the endorphins and so forth. Decreasing stress, helping you sleep better. You're in a better mood when you're connecting. So if you just focus on those things, a lot of these things are interwoven. And so they just become second nature. So you get a lot of bang for the buck with the whole food plant-based diet. You get a lot of bang for the buck with the regular exercise because your stress level goes down and you sleep better at night. And so just get the ball rolling, get started, and then as you do more and more and more, then it will become second nature. I like to use SMART goals. So when you have SMART goals, you have them for work or for business. So S, be specific. I want to eat more green vegetables. M, measurable. I want to have 3 more servings, a week. Achievable. Yes, go to the store and get it. R, relevant. Yes, if you want to decrease your risk of a lot of diseases, this is very relevant to your goals. And T, time bound. Do it for 2 weeks. So you create yourself SMART goals. You get through this SMART goal, then you go to the next one and the next one. And then you get used to doing these things and developing a plan for your future.
Amazing. Do you have any special tools or tech, to help us organize our health records? Is there any such thing for you?
Yes, my book, Patient Empowerment 101, More Than a Book, is an adventure. Again, is available on Amazon. And when you get the book, there are URL addresses in the book. You can go to my site, patientempowerment101.com, and you will land on the pages where you can download the components of a medical record.
Amazing.
So you download your medical history, your family history, all of these things, and you create your own medical record. All you need to do is go to the store, buy a 3-ring binder, get the little divider tabs, you download these forms, you fill them out. You can keep them on your computer and update them regularly and just print them out and switch them out as you go. But the book itself, it has these forms, but within the book. But if you want like a dynamic copy where you can keep adding things, and when you run out of space in the book, you don't run out of space on your computer. You can just download another copy and keep going.
Absolutely. We definitely need that because sometimes that organization is something that we're missing. Sometimes we miss appointments, or like you mentioned, you go to the appointments, but you don't have the whole story to tell. So you end up not having a productive meeting with your doc. So thank you so much for sharing that. I need us to be better advocates for you guys as our wives and sisters and moms. What can we do to better that environment?
I'm sorry, you're asking what you can do to be a better advocate?
Yes, for the women's health.
So for women's health, okay. So last year, the World Economic Forum and the McKinsey Health Institute put out a paper, a report. The gender health gap is the global gender health gap. It essentially costs women close to 14 trillion minutes of quality life each year. I don't mean third world countries alone. I mean America, Canada, Denmark, Germany, Africa, and you name it. I went from countries to continent, but you get the gist that there is a global health gap, and women, it's multifactorial. So a lot of it does have to do with the disparity in the research between diseases impacting men and women, and a variety of other things. And women often are not taken as seriously as men at the doctor's office. But by empowering yourself, so the doctor sits up and takes notice and does not feel that, okay, I need to get through this case, and they're looking like, wow, this person knows what she's talking about. And the doctor looks forward to seeing you because you're a true partner in your care. That is tremendous. So when I wrote the book, they changed the regulations in America, but when I wrote the book initially, the doctors had to document so many elements of what we call the HPI, and the records could be evaluated to see that you document enough to substantiate this level of care.
Right.
And so even though they don't need it for billing purposes anymore, it's still invaluable. So, for instance, one thing is the context. What were you doing? If you go to see your doctor and you say, my back hurts, and then you spend 10 minutes going all around the corner, he may end up ordering tests or just get frustrated. If you say, doctor, my back started hurting about an hour after I lifted heavy furniture, you just gave him the diagnosis. So let's move on. He'll examine, he'll be looking for specific things on your back exam. He's not going to order an extremely expensive MRI looking for cancer because you already told him the diagnosis. Doctor, I have chest discomfort in the middle of my chest. Associated findings will be, I have nausea, vomiting, I break out in sweat, but brings it on. Well, when I walk, it gets worse. You're telling the doctor, oh my gosh, I need to be concerned about blockage in the arteries. Versus I have chest pain that is a burning sensation, and it often comes on after I eat certain things. He's not going to be looking for a heart attack. And so this book goes over these key bullet points. So when you sit down, you have your 2-minute elevator speech. So your by the time you finish, your doctor should have a very short list of potential diagnoses. They told us that in medical school, and I thought the doctor was crazy. The doctor said, by the time your patient finishes the last sentence, you should know what's going on. I'm like, we have MRIs, we have all these things. What are you talking about? He was right. Because if the patient is informed, the patient can tell you 90% of the time, within a reasonable doubt, what your diagnosis is. But we have not trained people how to do that. We know how to do it. Doctors know how to do it. A lot of nurses know how to do it. But we need to empower patients. And so the first thing I say is become empowered. Also, you need to know your medications, your medical history, and all those things. And all of that is in the book as well. You need an advocate because, to be quite honest, if you're in the ER and they just gave you a shot of pain medicine and the doctor's coming in and asking you questions like, I don't know, and the person next to you, your spouse, may say, well, she's allergic to penicillin. Maybe that's not a penicillin allergy. Maybe she gets a yeast infection. That's not an allergy. If you need penicillin and your spouse is telling the doctor she's allergic to penicillin and you need it, you're going to get second line. So you and your spouse, everybody needs an advocate who has access to the medical history. I mean, the real medical history, not, the doctor told me I had a kidney problem 10 years ago. That doesn't mean anything. It could be so many different things. Be specific. And once you learn to be specific and you have all these things documented, make sure somebody close to you has access to that information. And when you go to the ER, especially the ER, they need to be with you. Right. Even in the hospital, it's good that somebody is visiting you regularly to be an advocate. That's very important. People get busy, mistakes are made, and if your advocate is sitting there, hey, why are you giving this person my mom this medication or my wife this medication? I'm sorry, this is for the patient next door. That happens. It does happen.
Right.
And so advocacy is very important.
Amazing. Thank you so much. Thank you. We need to be around, and as you mentioned, we need to be on top of our game in knowing the exact story, like what medication, what medical history, etc., etc. Amazing.
Absolutely. And as I mentioned, that gender health gap, I mean, a lot of women, I mean, if you Google it, there are going to be women all over who give you stories, I mean, different countries, continents, and so forth, about how they're not taken as seriously at the doctor's office. Or, I was having a heart attack, and my doctor just said it was my nerves. And so, when you're there with her, and you're advocating for her, the doctor is going to pay more attention. In most cases. Some doctors, they're going to do the right thing regardless. But there are those who may not take a woman's health as seriously as they would take a man's health. I remember in training, there was a doctor who said, "Oh, she's squirrely, don't pay attention to her." And, they just did not respect women, and that's just how it is. Some people are still like that.
Well, that's where your book comes in handy. So I appreciate you taking that initiative. So I know so far you have your mission is great, and by us doing better, our kids take notes, and that's legacy, right? By us doing the best things now, and our kids are learning at that moment. Is there anything else that you want us to reflect as parents? This is the last one. I won't bother you.
That's okay.
Yes.
8 out of 10 visits to the doctor's office are due to potentially preventable illnesses. I cannot stress enough the potential we have to prevent, treat, and reverse diseases. Healthcare costs are spiraling out of control. Don't put yourself and your family in a situation where you look back 5-10 years later. The medical bills are out of control. You can't get in to see specialists. You have a major disease that you would not have had if you had taken the steps now. Again, I'm not talking about an investment in any money, an investment in your time. It's an investment in your life expectancy and the health and prosperity of your entire family.
Amazing. Thank you so much. Thank you for being with us today and sharing your great wisdom. And I'll make sure that I provide all the links necessary for us to obtain the book and also learning more about you and your projects. Lifestyle medicine is amazing. I was influenced by it as well, and I was in the spirit of get stuff done, right? So I wrote in the most layman term possible about those pillars, but I did not touch all of them, about 3 or 4, and just briefly and stuff like that. So I wrote something and I sent it. So with intention of making a difference, that if I can inspire someone to eat better or exercise or sleep better, I made the difference. So I think I love that initiative, and guys, we need to take action. More information is not that useful if we don't take action. So I appreciate you being here today.
It's my pleasure. Thank you so much for having me, sir.
Awesome. Thanks so much. Thank you. All right. Thank you, guys. So go ahead and subscribe to thatpuzzles.com. We have the YouTube channel, Instagram. Give us a follow, and also do the same for my colleague, Coach Dr. Ann Hester. I'll be sharing her information as well. Until next time.